The concept is inside the population of follicular lymphoma, we can have low-risk patients and high-risk patients. The most important concept is to apply the POD, so the POD 24, the progression of the disease within the first 2 years. These represent the high-risk patients. Inside the CHRONOS-1, among the 170 patients that represented the total population, there were 93 patients with a POD less than 24 months. So we consider these patients high-risk patients. And when you compare the result in terms of clinical response between these high-risk patients versus patients with a POD more than 24 months, so low-risk patients, there are no difference in terms of complete response rate and in terms of overall response rate. So the concept is, with copanlisib, you can obtain the same clinical response also in high-risk patients. And also, if I check and compare the data in terms of median progression-free survival and median duration of the response, there are no statistical significant difference. So the quality of the response in terms of CR rate and overall response rate and the duration of the response in terms of median progression-free survival, median duration of response is the same when I compare patients considered high risk according to the POD 24, less than 24, versus low risk patients when I consider a patient with a POD more than 24. This is another important concept regarding the real role in terms of clinical efficacy of copanlisib as a single agent in the treatment of this setting of patients. This is a very important message because, as I said before, the specific toxicity, extrahematological toxicity of copanlisib are hyperglycemia and hypertension. Hyperglycemia could be a problem if you have to treat a patient with diabetes. But at the end of the day, with this data, we demonstrated that there is no real problem, and you can follow very strictly the patient, in particular for the first 4-6 weeks, but you can continue the treatment. And at the end of the day, when I compare the clinical response data between patients with diabetes or hypertension at the beginning of the treatment versus the remaining patients, there are no statistically significant difference, also in terms of percentage of discontinuation.